Thanks very much, and what a splendid turnout. And I think this is just a start. Actually, I think there's going to be much more movement, much more action, and we're going to have to keep the pressure up, and we're going to have to really build a movement to stop some of these disastrous changes going through. And I think that what we've got in this government, we've only been in 4 months, and we've already got a long catalogue of pledges that they made in the run-up to the election that have already been broken. And one of the ones, Shirley's a lucky case. The Whittingtons say for the time being, you're a lucky one. They've announced today that one of the hospitals that the local Tory said he had personal word from Andrew Lansley wouldn't close as just losing its A&E. That's Queen Mary's in Sidcup in South East London. Okay, that's no big surprise. And the way they've done it is no big surprise. They say they can't recruit staff. Well, it's obviously difficult to recruit staff if you've already told people for years and years you're going to close the hospital. Who wants to join the staff of a closing hospital? And then they come along and say, well, it's for patient safety because we can't staff it. Well, you know, this is not the first time. They've been doing this type of thing for 20, 30 years back in the NHS. It's a time-honoured manoeuvre, and we can start to see it taking shape, not just in London, but other parts of the country as well. Other parts, just down the road here, we've got Chase Farm. Andrew Lansley came up to Chase Farm and promised a moratorium, didn't he? A moratorium on hospital closures. Mind you, he said, if they've already had a consultation, then it might not take place, then that might not take effect. And there's various other ways in which it might not take effect. Well, Chase Farm, I'll tell you, Chase Farm is going just the same way. And just down the road, King George's Hospital in Ilford is also going just the same way. So, you know, that moratorium wasn't worth the, well, it wasn't written on much in the way of paper, but it wasn't worth anything whatsoever. In fact, the Department of Health has now said it doesn't apply anyway from next month. So